Hi, welcome back to my channel. So for the past few days, I have been vlogging about my travels and how we celebrated Christmas. Time to post more informative videos. Dahil napansin ko na wala masyadong nagpo-post o wala masyadong nagvo-vlog about theater nursing dito sa UK, I've decided na I may as well start sharing things. The differences that I've noticed since I started working here. I understand na hindi lahat ng hospital pare-parehas. So what I'm going to tell you guys today are the differences in my previous hospital in the Philippines and what we use in my current trust. So on top of the list of the differences that I've noticed is the roles. Dito sa UK, there is a group of healthcare professionals we call Operating Department Practitioners, simply known as your ODPs, and they are specially trained to work in the theater. In the Philippines, wala tayong ganun. In nursing, we don't really study perioperative as extensive as ODPs do. During our college days, nag-rotate tayo sa OR for a number of days or a number of weeks, pero it's not that in-depth. Hindi siya in-depth na training. So to start with the roles, the following professionals can be found in my previous hospital in the Philippines. So we have the scrub nurse, the circulating nurse, the PACU nurse or recovery room nurse. Of course, we have the charge nurse, the head nurse. We also had attendant, a porter. Of course, hindi mawawala yung surgeon and the assistant surgeon if applicable. Tapos, syempre, the anesthesiologist. So now, let's talk about the responsibilities of the nurses in the Philippines and dito sa UK. Let's start with who receives the patient from the ward kay papunta sa theater. In the Philippines, this was the responsibility of the circulating nurse. So when you receive a patient from the ward nurse, there is a handover, there's an endorsement from the ward to the circulating nurse. And a part of the endorsement is a pre-operative checklist kung saan we double check kung na-prep na ba yung patient, naibigay na ba yung mga pre-op meds, etc. etc. In the UK, it doesn't exactly work like that. It looks like there are two circulators. One practitioner circulates for the scrub team and the other circulates for the anesthetic team. Neither sa dalawang to ang susundo kay patient. It's usually a porter or a TCA na pupunta sa ward at kukunin si patient or susundiin si patient. Next, responsibility, who assists the anaesthetist. In the Philippines, it's still the circulating nurse. Where I came from, I'm not sure with other hospitals in the Philippines, but where I came from, there's only one circulating nurse. It's very rare to have two circulating nurses in one theater suite. So the same person who circulates for the scrub team will circulate for the anesthetic. So he will prepare the equipment of the anesthetist. Kung kailangan ng extra medication or drugs, siya yung magiging runner from the theater suite going to the central supply room. In the UK, you have the anesthetic practitioner. From what I observed, not all anesthetic practitioners draw medications and serve to the anesthetist. According to the ODPs na nakausap ko, it depends on the preference of the anesthetist. There are some anesthetists who prefer that they draw their own drugs for safety reasons. Kasi sila nga naman yung magbibigay, dapat lang sila yung magdodraw. So that's the principle. Sometimes there are anesthetic practitioners who draw the drugs. In the Philippines, ang nag-i-insert ng IV line is yung circulating nurse o kapag mahirap, well, yung anesthetist. Dito sa UK, ang napansin ko, mas common na yung anesthetist ang nag-i-insert ng IV. Siya yung nag-start ng IV line. I haven't seen the anesthetic practitioner start an IV line, although, as far as I know, some of them are trained to do so. Not everyone is trained in cannulation. In the Philippines kasi, if you become a registered nurse, it is expected that you have the competency to start IV cannulas and to manage IV cannulas. Here in the UK, you don't get automatically signed off for this kind of skill just because you have your PIN and you are registered in the NMC. You have to undergo further trainings so you can start cannulation and manage IV cannulas, including pagtanggal ng cannula. Kailangan mo pang ma-sign off para doon. So, hindi lahat ng anesthetic practitioner are signed off for that. Anyway, next responsibility is skin prep. Sino yung nag-prep nung operative site prior to surgery? From where I come from in the Philippines, it's the circulating nurse. So how we do it is we often wear two sterile gloves, one pair for the cleanser and one pair for the povidone iodine. In the UK, it's the scrub practitioner who preps the skin. But sometimes, kapag masyadong maraming instruments yung scrub practitioner, it's the surgeon or the assistant surgeon who does the skin prep. Next, insertion of the IFC. In the Philippines, it's the circulating nurse who inserts the IFC. Usually, in-insert namin yung IFC before the skin prep. In the UK, just like skin prep, it's the scrub practitioner who inserts the IFC if he is signed off for IFC insertion. Kung hindi siya na signed off or wala siyang competency pa, it will be the surgeon or the assistant surgeon who will do it. Next, sino yung nagpre-prepare ng back table and mga instruments? Doon sa Pilipinas, ang gumagawa nito is the scrub nurse. Hindi ka matutulungan ni circulating because the circulating is already busy assisting the anesthesiologist. Siyempre, busy pa siya sa pag-skin prep. So, it all falls down to you as a scrub nurse to ensure that you have the complete trays, complete supplies, para naman hindi kawawa sa circulating mamaya. In the UK, dahil meron kang anesthetic practitioner who assists the anesthetist, you can rely on the TCA or on your circulating practitioner to help you open the trays and prepare the equipment. In the Philippines, we prepared the equipment and the back table prior to scrubbing. So, ino-open namin yung pack bago kami mag-scrub. In the UK, it's magi-scrub yung practitioner, nakasuot na siya ng gown, gloves, then papasok siya sa theater suite doon sa maliit na kwarto sa loob. And then, the circulating will help him open the pack. And then, the scrub will arrange the contents of the pack. And then, the circulator, isa-isa niyang i-open yung supply, i-drop niya doon sa sterile field na ginawa ni scrub practitioner. Speaking of opening packs, from where I came from, sa Pilipinas, kapag kunwari, kailangan mong ayusin yung laman ng table without disturbing the sterility, we use sterile forceps, yung pick-up forceps na nakababad to arrange the contents of the table before we scrub. We know na walang makakatulong sa amin kasi busy lahat. In the UK, you will never find a pick-up forcep in the theater suite. Huwag kang maghanap ng forcep kasi hindi sila gumagamit na ganun kasi hindi yun ideal. Next task, who serves the surgeon or the assistant surgeon? In the Philippines, the scrub will serve the gown and the gloves to the surgeon and the assistant surgeon. Kailangan mong master yung skill nung paano ba i-position yung gloves, paano yung tamang pagsuot ng gown doon sa surgeon kasi syempre baliktad. Syempre you have to be careful with the size of the gloves kasi mamaya magkamali ka or the number of gloves, especially for orthopedic cases kasi nagdo-double gloving sila. In the UK, you're not expected to serve the surgeon. Actually, habang nag-i-induct sila ng anesthesia, nag-i-scrub na yung nurse or sometimes nauna pa yung pag-i-scrub ng nurse kasi ang dami ng instruments na i-prepare, ang daming layout ni scrub practitioner. The surgeon is going to scrub, wear the gown and gloves on his own. You don't need to serve him or her or his assistant. Next, who accomplishes the surgical safety checklist? In the Philippines, it's the circulating nurse. Then it will just be countersigned by the surgeon and the anesthetist. In the UK, there will be at least 2 persons who will accomplish the surgical checklist. So these persons who accomplish the surgical checklist in the UK, anesthetic practitioner, the scrub practitioner, the circulating practitioner, and sometimes the surgeon. Hindi lang iisang tao ang gumagawa nung form na yon. Next, who secures the specimen? Both countries, it's the scrub practitioner who secures the specimen. So, pag sinabi ng secure the specimen, kailangan ilagay sa tamang lalagyan with the proper preservative, formaldehyde man or alcohol. Sino yung magdadala ng specimen sa laboratory? Sa Pilipinas, it's still the scrub practitioner who goes to the laboratory, make sure that it is well documented, labeled, and from the correct patient. Sa UK, the scrub practitioner will hand over the specimen to the porter and it's the porter who goes to the laboratory to send the specimen. Hindi lumalabas ng OR complex or theater complex ang scrub practitioner dito sa UK. Well, unless kung kakain siya siguro sa canteen, then yan, lalabas siya. And finally, who will endorse the patient from the theater to the recovery unit? In the Philippines, again, it's the circulating nurse. That means the circulating nurse is the only nurse na nagsusulat doon sa chart. In the UK, it's a little bit tricky kasi the scrub nurse also writes in the perioperative pathway. The anesthetic nurse may or may not write depending on yung details na kailangan. The one who hands over the patient to the recovery practitioner are the scrub practitioner and the anesthetist. Very rare na nag-hand over si anesthetic practitioner kasi after one case, kailangan niyang i-prepare yung suite for the next case. Sa Pilipinas, makakausap mo yung anesthesiologist kung may i-refer ka or meron siyang bagong order or meron siyang unusual na order. In the UK, talagang makakausap mo si Anaesthetist kasi siya mismo yung mag-endorse nung patient niya sa'yo. So what are the contents of the endorsement or the handover I will discuss in another video.